key takeaway from our article is that cancer prevalence differs meaningfully across the urban-rural spectrum. Instead of treating rural areas as homogeneous groups, it's important to recognize the diversity among urban cores, large towns, small towns, and isolated rural areas. Tailoring healthcare strategies and research efforts to these distinctions is essential to effectively address cancer disparities. My name is Christine Preisel, and I'm the lead author of the manuscript titled Midwest Urban-Rural Differences in Cancer Prevalence, which will appear in Mayo Clinic Proceedings. We analyzed data from nearly 650,000 individuals from a 27-county region in Minnesota and Wisconsin. Our study found that cancer prevalence varied based on where people lived: urban, large town, small town, or isolated rural area. For example, we observed that men and women living in isolated rural areas had a higher prevalence of Hodgkin's lymphoma than urban residents. Additionally, we observed among females, those living in large towns and small towns had a higher prevalence of colorectal cancer compared to their urban counterparts. And these findings emphasize that rurality is not a one-size-fits-all. Instead, an urban-rural continuum exists, and we should be mindful of this in public health and clinical approaches related to cancer care. Mayo Clinic is unique as it houses the Rochester Epidemiology Project, a medical records linkage system which allows for a population-based examination of cancer prevalence across the urban-rural continuum. And this comprehensive medical records linkage system enables population-based studies across urban and rural settings, giving us the tools to examine health patterns with a depth and precision that few institutions can match. These findings suggest that clinicians and health systems should consider the nuances of rurality when developing and delivering cancer-related care. Categorizing areas as simply urban or rural may obscure important differences in patient needs, experiences, and environment that may impact cancer-related outcomes. There are different degrees of rurality which may influence cancer prevalence, and understanding these patterns allow healthcare providers to tailor cancer screening, education, prevention, and care strategies more precisely. For patients, this research highlights the importance of having access to timely cancer screenings, diagnostics, and care, regardless of where they live. It also underscores the need for healthcare services and interventions to be tailored to the unique needs of different rural communities, ensuring that care is both equitable and responsive. The next steps involved examining why these urban-rural differences in cancer prevalence exist, whether they are driven by environmental exposures, differences in healthcare access, behavioral factors, or a combination. Additionally, there's a need to study cancer incidence and survival, not just prevalence, to develop more targeted and effective prevention and treatment strategies across the urban-rural continuum. If you're interested in learning more, please look for our article titled Midwest Urban-Rural Differences in Cancer Prevalence, which will appear in the July issue of Mayo Clinic Proceedings.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings. Our journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.